to get started. Good evening, everyone, and thank you for joining our Men's Health webinar. We'll start with a few housekeeping items, and then I'll introduce tonight's speaker. First, your participation in tonight's webinar is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speakers. If you wish to ask a question, please type it at the chat box at the lower part of your screen, and we will have a Q&A portion at the end of the presentation to address these questions. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Majdee Islam of Urology of St. Louis. Dr. Islam received his Bachelor of Science from the University of Missouri in Columbia, Missouri, before continuing to complete his Doctor of Medicine. He then went to Washington University in St. Louis to attend his internship in general surgery. Dr. Islam then completed his residency in urology at the University of Colorado in Aurora, Colorado. Finally, he attended the University of California in Los Angeles for his fellowship in male reproductive medicine and surgery. At the end of Dr. Islam's presentation, we will also hear from Cliff, a patient champion who has also suffered from ED and has now found a solution that works best for him. Dr. Islam and Cliff will both be available for questions at the end of the presentation. And again, thank you for joining us tonight. And now I'll turn it over to Dr. Islam to get us started.
All right, well, I appreciate everyone being here. My name is Dr. Majdee Islam. As Annie said, I'm going to go ahead and share my screen, and we'll go ahead and get started. Perfect. All right. So just like Annie mentioned, today we're going to talk about erectile dysfunction, essentially, signs and symptoms, and then treatment options. That's me there. I have offices all around St. Louis, Alton, Walker Medical Building, which is kind of right here in kind of West County, and then in Fairview Heights, Illinois as well. So we'll go ahead and get started. We'll talk about the topic of the night, erectile dysfunction and the treatment options. And so an important part of understanding treatment options is understanding erectile dysfunction in general, causes, et cetera. And so the important thing for people to know in general is erectile dysfunction isn't necessarily the inability to get an erection, period, but it's the inability to get an erection that's rigid enough for a patient's satisfaction, whether that's for intercourse, for masturbation, et cetera. So I think it's important for guys to know that it's not just if you can't have an erection, it's if you can't have an erection that's rigid enough for your own personal satisfaction. So the other important thing is it's quite prevalent. So 1 in 5 guys over the age of 20 have some aspect of erectile dysfunction in their entire life. The other thing that's important to know is over half of guys that are over the age of 40 have some aspect of erectile dysfunction. So, it's super important to note that, a lot of guys feel like it starts to come along as they get older, or something comes up that we'll talk about in just a bit that causes them to have erectile dysfunction. But the important thing to know that is you're not alone. It's quite common, and there are treatment options. And so the reason behind that, in terms of getting an erection, you have a bunch of blood vessels that you can see that's in the 2 cylinders that are in the penis called the corpora. Those blood vessels get a bunch of blood flow in them, and as the blood vessels get blood flow, they expand, and then they basically cause smooth muscle relaxation. Long story short, they compress veins and then cause the penis to get nice and erect, as you can see on the picture on the right. The problem in general with getting an erection is in the inability to have either blood flow go into those arteries, or the inability to have the nerves get stimulated to be able to start the process of getting blood flow into the blood vessels, or a combination of both. And so the 3 things, most common things that can cause issues from that standpoint are some kind of vascular issue, something that's causing a blood flow problem, diabetes, or other medications. And so the important thing to note here also is that it's very common to also see guys that have had prostate cancer treatment that kind of falls into the medication category that causes erectile dysfunction, as well as things like diabetes and heart disease. So there's quite a few things that can cause erectile dysfunction, but these are the most common things that guys find, that we have found, that in men that have erectile dysfunction, these are the etiology or the causes. Now, another really important thing about erectile dysfunction is the psychosomatic or the mental aspect, the psychological aspect. So quality of life with erectile dysfunction can really significantly hinder a man's overall just well-being and happiness. So you can kind of see here in this graphic, quality of life from an erectile function standpoint, it can truly affect a number of things, which include an ability to have a guy be in a normal, healthy relationship, even along with just mental health in general, literally physical discomfort, and all a significant amount of other things. And so, erectile dysfunction is not only a medical issue, but more importantly, it can really have an effect on a guy's quality of life. And so, that's important to note, as I'm sure many men have experienced or potentially can experience in the future. So, going into the causes just a touch, erectile dysfunction and diabetes. So, diabetes is a pretty, maybe not super obvious, but pretty significant cause of erectile dysfunction. You know, in terms of men with erectile dysfunction, guys with diabetes are more likely to have erectile dysfunction earlier in their life. About half of men with diabetes have problems with erectile dysfunction. And interestingly, but most importantly in my mind, guys that have diabetes are less likely to have an effect from a positive effect from medications or oral therapies for erectile dysfunction. And so it's important to note that if you've got diabetes, you're more likely to have more severe erectile dysfunction, and you're also more likely to not be able to get as much symptomatic improvement as other men do. And so, from a diabetic standpoint, the reason that guys with diabetes have such severe erectile dysfunction overall is because there's an issue not only from a blood flow standpoint, but also from a nerve standpoint. So, diabetes can damage the nerves that stimulate the process to be able to get blood flow to the penis to get an erection. And then on top of that, the blood vessels actually take a hit from the diabetic standpoint in terms of actually getting what's called endothelial dysfunction or damage to the arteries itself. And so because of that, it's a little bit more difficult to treat from an oral medication standpoint or to take pills to treat the guys with erectile dysfunction that have diabetes. Now, the main things that that cause guys that are diabetic to have a higher risk of erectile dysfunction are guys that are older, diabetes that's not as well controlled, and then other things like diuretics, cardiovascular disease, and then other types of microvascular complications, meaning something else that's causing damage to the blood vessels that compounds the diabetes damage to the vessels themselves. Now, kind of a sidebar with diabetes and heart disease, there is a significant relationship between diabetes and heart disease. And oftentimes, and most importantly, we'll talk about this a little bit more in detail later, but erectile dysfunction oftentimes precedes the signs and symptoms of coronary or cardiac disease as well as diabetes. And so it's important to know that sometimes even 3 or 4 years before a guy has any signs of heart disease, you can have erectile dysfunction issues. And so it's important to not only get the erectile dysfunction treated, but more importantly, to get a workup to make sure that you're not missing some kind of cardiac issue that may be coming down the road. So going into that, heart disease, just like we mentioned, it's very common to see erectile dysfunction prior to having some kind of cardiac event or finding out that you have coronary artery disease or heart disease. So ensuring that I talk to this about with my patients all the time, but ensuring that you have a primary care physician and ensuring that you see your primary care physician if you don't have one, if you've got signs of erectile dysfunction. And the reason behind that, you can kind of see here, the penile artery is quite small, much smaller than the artery that supplies the heart and a lot of the other arteries. And so oftentimes that artery in the penis gets affected much more quickly because it's much smaller and it's going to get essentially damaged more easily than the other arteries, or clogged essentially more easily than the other arteries. And so again, really important to note that seeing a primary care physician can not only help with improving your risk factors to getting to the point where you have heart disease, but also improving your risk factors in general for a healthy quality of life, diet, exercise, smoking, etc. So a quick blurb about testosterone. So low testosterone is very often seen in guys that have erectile dysfunction. So oftentimes when I have guys that come in that have erectile dysfunction, we'll go ahead and test for low testosterone if they haven't been tested for testosterone yet, because it commonly can affect sexual function. When guys get on testosterone, it can improve sexual function. And then lastly, oftentimes whenever guys have other comorbidities like diabetes, obesity, they're more likely to have low testosterone that affects all of the above. So it's something that's important to note to potentially get tested for or to talk about getting tested for. Testosterone not only affects sexual function, but also things like fatigue, muscle mass, or mental things like feeling a little bit down, feeling some concentration issues or brain fog. And so it not only affects sexual function, but also overall quality of life in general. Again, another reason why it's important to test for if somebody has signs or symptoms. There's treatment options that we won't go into too much detail for this talk, but they include things like gels, patches, pills, and most commonly injections that can treat you for it. So prostate cancer treatment, this is a big one. Whenever a guy has prostate cancer, whether it's surgery or it's radiation, those treatment options can damage or potentially temporarily damage the nerves that control erectile function. Now, it can be a temporary process where over time those nerves can start to heal up, but oftentimes after sometimes 9 months to a year, it's difficult to regain function of those nerves, and in turn, difficult to be able to obtain or maintain an erection. The reason is because those nerves wrap right around the prostate. So that treatment, the surgery versus the radiation, affects the nerves and then doesn't allow those men to be able to regain the function of those nerves. Oftentimes they can, but sometimes they can't. So it's important to note for guys that have prostate cancer treatment that can really truly affect their erectile function. About half of men that have radiation for prostate cancer or that have surgery for prostate cancer can have their erectile function affected. So it's important to note that you may have your erectile function treated, and it may not always necessarily come back with just normal lifestyle things like diet and exercise, etc. Peyronie's disease. So I treat a lot of Peyronie's disease. It's basically curvature of the penis that's caused by some kind of damage, whether that's trauma or micro trauma, or even just something as simple as you had an erection, you rolled over in the middle of the night, and you had a little bit of a small injury or inflammation. But it's important because when you have Peyronie's disease, more often than not, it's because either you've had some issues with erectile function, and so that causes your penis to be able to bend more often, or the opposite, or someone gets Peyronie's disease, and because of Peyronie's disease, you're not able to expand, the blood vessels aren't able to expand as well, and so you're not able to get as good of an erection. And so these can kind of come hand in hand. Erectile function dysfunction can oftentimes cause Peyronie's disease. Peyronie's disease can oftentimes cause erectile dysfunction. So the nice thing about it is oftentimes we can treat both at the same time in certain ways, which include things like a medication called Xiaflex that I do quite often, where we inject that scar tissue, or surgeries like suture to correct the curvature, or even a penile implant to correct both at the same time, which we'll talk a little bit more about in the near future. So erectile function, who can treat it? So first and foremost, your primary care physician oftentimes is your go-to for any kind of medical issue, and erectile dysfunction is one of those issues as well. More often than not, your primary care physician will either try a medication for you, something that's just straightforward and not over the counter, but a prescription that's very easily obtained at a Walgreens or any kind of pharmacy, or they'll send you to a urologist, someone that specializes in erectile dysfunction. Primary care physician is a very important part of this whole process, not only because they help with guiding you to go to the right place, but also, again, to make sure that there's nothing else that's going on that can potentially affect you negatively from a quality of life standpoint. Now, these are all the treatment options for erectile function. We'll go over these here in a little bit more detail. The first is oral medications, oral therapies, so pills, Cialis, Viagra, things of that nature. The idea is they increase blood flow to the penis by relaxing the smooth muscle that we talked about that's in the penis. They work quite well. You can either take them daily as a normal medication you take just with your other meds, or take them as needed prior to sexual activity. Medications work pretty good in a lot of guys. It ranges from about 40% to usually 80 to 90%. However, oftentimes when guys have things that are higher risk factors for more severe erectile function, like diabetes or prostate cancer treatment, it's not as effective. It can be quite effective for a lot of guys. However, it's oftentimes either with time or with progression of disease processes, it can be less effective. This is the standard protocol for the first option for treatment of erectile function. There are some side effects that include things like headaches, facial flushing. Those are kind of the two most common. Sometimes acid reflux or heartburn as well. And then usually we want to make sure that you're not on other medications that could potentially cause you to have a drop in your blood pressure. Most commonly, if you have heart disease and you're on a nitrate medication, we don't want you to double up and then potentially cause an unsafe drop in your blood pressure. So that's something that we will talk to you about if that's a potential issue. Now, the next option is what's called a vacuum erection device. Now, what that is essentially it's a little cylinder that goes on top of the penis. There's a vacuum suction that then brings in blood flow to the penis. And then once you have enough blood flow, you put a little constriction band that goes down on the base of the penis, traps the blood flow in there, and you've got this erection. So it sounds great. It's it's a little bit cumbersome. It's not the most comfortable thing in the world, and it's not super effective. Some patients have a decent amount of success with it. Overall, the data show that it's around 70 to 75% effective. I'd say in my patients, it's around that, maybe a little bit less, but most importantly, it's just not the most comfortable or spontaneous thing in the world. So I have a lot of patients that start to use it and then get to the point where they move on. And so that's something that's important to note, that it's not usually super painful, but it can be a little bit uncomfortable. It can cause a little bit of bruising and swelling of the penis. It can also cause some decreased sensation of the penis as well. Now, this I won't talk about too much. I actually don't prescribe this too often. It's called a urethral suppository. So it's either a liquid or a small pill, a suppository that you push into the P channel. It's uncomfortable. It can cause burning in the P channel, and it's, to be totally honest, not super effective. And so I usually actually don't prescribe this to my guys because it's not super effective, and there's things that are much less uncomfortable that are more effective that we'll talk about here in just a second. Well, that's now. So intracavernosal injection. So this is an injection that you would do of a liquid version of a medication that induces blood flow, dilation of the vessels in the penis, in the penile artery. It's quite effective. The data shows it's around 70 to 75% effective. To be totally honest, in my patients, it's probably around 90% effective, where you can usually find the dose that works for you. Basically, how it works, you inject the side of the penis, kind of like in that picture there. About 5 minutes later, the medication starts to work. Of course, the positive is it works quite well. The negative is you're taking a needle to the side of the penis every time you want to try to have an erection or erectile function. And, in some patients, in about 3% of patients, you can have this penile ache or discomfort. You can have a little bit of scar tissue that forms, and occasionally you can have a little bit of dizziness or lightheadedness. But also, most importantly, it's a needle. And so I have quite a few patients that are very happy with this. However, after a certain point in time, the most common situation is either the medication doesn't work as well anymore, and that's why the patient moves on to something else, or they're just tired of doing injections. However, again, I have plenty of patients that use this, enjoy it because it works quite well, and get used to the fact that it's a small pinprick every time they want to have an erection. So penile implant. So the penile implant is a surgery where basically there's 3 pieces that we'll talk about in just a second that go into the penis and the scrotum. You pump this pump to basically get an erection, and then after you're done, you press a button on top of the pump to reduce the erection. That pump sits in the scrotum, so it sits in between both testicles. The cylinders go in the penis, and then there's something called a reservoir that houses the saline that'll go back and forth from the penis whenever you want to have an erection. It takes about 15 pumps to give yourself an erection. The most important part about this is sensation is completely intact, both penile sensation and orgasm sensation. And every time you want to have an erection, you just press that pump. You can do it whenever. You can keep the erection erect for as long as you want to. And most importantly, it's completely natural looking, and most guys are very happy with not having to take medications, injections, or anything like that, and just being able to have a spontaneous erection whenever. 98% effective. About 95% of patients and their partners are very happy with the results from the procedure. But of course, the con is it's a surgery. So you're going through a procedure that takes about 1.5 hours. And you have an incision in the scrotum. Sometimes you have a second incision in the groin area. And you're for about 3 to 4 weeks, you're taking it about as easy as you can from a major physical activity standpoint. You're not bedbound. You're not, just sitting around the house by any means. Usually you're able to go back to just normal, regular activity like walking stairs, dishes, laundry within usually about a few days. So to go into this a little bit more, I'm going to show you this quick little video. Let me back up a little bit. So the idea is it's all placed in the skin. So there's nothing outside of the body that you can see, but within the body, you've got this pump that's in the scrotum in between both testicles. As you pump, the fluid comes on from that reservoir that's behind the bladder, and then you get this erection. All that fluid now is in the erection. You use it as long as you want to, and then once you're done, there's that little button that's on top of the pump. press it for about 3 seconds, hold it, and then all the fluid goes back into that reservoir, and you get a flaccid penis. It looks just like a normal, natural penis. So if you're in the locker room, nobody would have any idea that you've got something in there. And when you have an erection, nobody would have any idea that it's not a normal, rigid erection. So the benefits, just like we talked about, all inside the body, natural looking erection, completely spontaneous, very, very high patient satisfaction once they've gotten down this far down the road where they're saying, okay, I'm ready for something invasive like a surgery. Now, the risks. There's always risks with surgery. The most important risk I always tell guys about is infection. So anytime there's a foreign body that's placed in the body, there's a risk of infection. Guys that are diabetic and that have had radiation are at a slightly higher risk for that. I do a lot of things to try and reduce that risk, like antibiotics, a wash, etc. But there's a risk of infection about 1% or less. A risk of what's called mechanical failure. The implant stops working after a while. Usually the implant works for about ballpark 12 to 15 years, sometimes longer, rarely shorter, but it's usually working for quite a few years. So you have plenty of use. And then oftentimes, if it malfunctions or stops working, it's a very straightforward process to replace the old one and put a new one in. There's going to be some discomfort afterwards, swelling, bruising, etc. after a surgery, just like any procedure. And occasionally, some guys have discomfort that lasts for more than the 4 weeks after surgery. It's pretty rare. And then finally, there's a chance that the implant goes somewhere where we don't want it to go. That's called migration or erosion. Pretty uncommon, but those are all the risks that I talk with all of my patients about. All of those are pretty rare. I, knock on wood, haven't had any major issues with any of those. I had one patient that had a little bit of one of the implants moved a little bit. It was a very straightforward process to fix that, and the patient's extremely happy with where things are at. My point being, super low risk. Most patients are extremely happy. Knock on wood, I haven't had any patients that have been unhappy with their decision yet. And the last kind of most important, or maybe most important thing, a very important part of it is insurance. Insurance isn't guaranteed to cover this implant, but very, very likely it will cover the implant. I've had very few patients, I should say, that have not had the implant covered by insurance. We've had pretty good luck with that. So overall, and I'm happy to take any questions at the end. I'm going to have Cliff give you guys a quick talk about his experience here in a second. But erectile dysfunction is super common, super oftentimes easy to treat. But the important thing is there's quite a few things that we can do to treat erectile dysfunction. But overall, most importantly, making sure that you're getting yourself checked out from a quality of life standpoint. If you have erectile dysfunction, covering your bases from a heart disease, diabetes standpoint is super important. And then finally, even if you feel like you're at the end of the road, at the end of the day, the penile implant is an excellent surgery. My patients have had great success with it and are very happy with things. And so make sure you check out this website if you have any more issues or questions to either find a urologist like me that does penile implants, or to get more questions answered about erectile dysfunction in general. Okay. Now I'm going to go ahead and turn it over to Cliff here, if I can figure out a way to stop sharing my screen, because oh my gosh, this is terrible. There we go. Stop share.
Good evening, everyone. I'm going to tell you basically the journey that I and my wife took from the time I was diagnosed with ED through today. When I was 58, I was diagnosed with prostate cancer. Prostate cancer was a very slow growing cancer. Doctor said you have a long time to think about it. My time was, if it's there, I want it out. So I had my prostate removed. After the prostate was removed, I went back to my internist, and not having any erections, they put me on Viagra. Unfortunately, I was one of the people that got terrible, terrible headaches from the Viagra. So they moved me over from Viagra over to Cialis, same problem. We moved from Cialis to Levitra, that same problem. So we finally gave up on the pill medications. I did use the external vacuum device. As Doc said, it does work. However, it is not very spontaneous. Number two, one of the things that is kind of different about it is your penis does not look normal, really. It turns a little blue, it's cold, it's not very appetizing to your spouse. Uh, and the problem I had basically was removing the contract band over the head of the penis. It hurt me. So after using it for about 3 months, 4 months, gave it up, and at that point went into a major, major depression because at that point I knew nothing else about what could be done for ED, and I basically lost my manhood. And my wife was like, maybe he's seeing another woman, maybe he doesn't love me anymore, which is the farthest from the truth. So one of the things I will tell you right off the bat is when you've decided to go to see a prosthetic urologist, my suggestion is to take your partner with you and let them understand what is actually happening and what you're going through. In the 2 years that I waited, we basically lost all our intimacy. At age 60, the day after my 60th birthday, I had my first implant done. I was home for a week and a half. I went back to work after a week and a half. Third week, I went back to the doctor. He showed me how to use the implant. He said, go home, use it a few times, get used to it. And when you're comfortable with it, you're free to have intercourse. I was basically truthfully amazed at the fact that my wife looked at me and said, I can't tell there's anything inside you. And had she not known me before, if you have, a friend or something like that, that has not seen you before, she knew I had something in me because the girth of the penis is a little greater with the implant. But after 4 weeks, all the swelling was down. I went back to work, and I also, after 2 weeks and after 4 weeks, I also went back to working out at the gym. I worked out with the gym with the same guys I worked out with before. I showered with them. They have absolutely no idea that there's anything inside me that is not natural. Few things I will tell you. Number one, I had that implant for 14 years. And at the end of 14 years, I had it replaced. The replacement surgery was a lot easier and faster to heal from. I've had it now 4 years. I am 77 years old. If this one lasts 14 years, I'll be back in the office and I'll get another one. It's as simple as that. I will not lose my manhood ever again because this is not an issue that, is easy to deal with. People ask me, well, what happens when you go through the airport? Does the alarms go off and stuff like that? The answer is absolutely not. They say, okay, but I have artificial knees, and then they take me over to the corner and they put this wand up and down my body and inside my thighs and around my crotch. Nothing happens and they let you go. So it doesn't show up for anything. It doesn't stop you from having any type of tests like MRIs, PET scans, CAT scans, or anything like that. It has nothing to do with your urination or bladder issues. As a matter of fact, I've had 2 cystoscopies since I've had the implants, and they both went very, very easily. And the doctor said, oh boy, I wish all my male patients had implants because if you pump it up a little, it's a straight shot in. So it was wonderful. The other thing that's really good about this is when you are on using injections, things like that, or the little pills, the little mousse pills, you have to keep it refrigerated. And that means when you travel, you've got to make sure you've got it on ice and that wherever you're going has a place to keep it. That could be a problem sometimes. And what's interesting is I go wherever I want to go. My erection goes with me wherever I want to go. I pump it 12, 15 times. I have a solid, rigid erection that's good for any type of intercourse you want to have. It's an erection that you don't have to worry about leaving it up for over 4 hours. Not that you're going to do that, but reality is you can leave it up 4 hours, 40 hours, or 40 days. It's not going to hurt you. You basically have this device that will let you have intimacy again with your spouse, with your partner, and have a normal sexual life that really, truthfully, the first time we had intercourse after I had the implant, I can't tell you how much intimacy we found out we had lost and then regained from the implant. So my suggestion, basically, truthfully, is the 2 weeks of, I didn't have a lot of pain. The 2 weeks of just being a little painful, discomfort is more what I had. I took Advils, they worked fine. And like I said, I did it a second time, I do it a third time. There's nothing but praise for this, for the people who invented this thing. It's phenomenal. It really is. It will change your life and give you back your manhood. So I will change it back to the doc. If people have questions for him or me, I'd be happy to answer.
Thank you both so much.